Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Anusha Rana. She's going to
Anshu.
be talking about the importance of pre pregnancy checkup. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hi, thank you. Good afternoon, everyone. Myself, Dr. Anshu, Senior Consultant at Apollo Cradle Hospital, Greater Noida, and in Department of Obstetrics and Gynecology. So today I am going to discuss here the topic which is nowadays very important. It's pre-pregnancy. What is the importance of pre-pregnancy checkup? So nowadays, although we started gradually seeing the couple themselves used to come if they are planning for a pregnancy, and they used to get themselves checked if they are planning, and it's always better if they used to come beforehand. But the who is not knowing the what is the importance, why we should go, and what will be the added benefit after this preconceptional visit. So that for them, it's really a very important topic. So initially, earlier days, because of our the socioeconomic situation and the social things, the people used to get married in an early age, and they are till the time they will be aware about they used to get pregnant. So these are the stories of past. Nowadays, the everybody is doing everything on a planned basis, and which should be ideally done. And why not the pregnancy should be done on a plan? So, if you are planning for a pregnancy, you should come and visit your doctor, gynec beforehand and get yourself checked. So, today I'm going to emphasize on what are the benefits which will be happen if you will visit to your doctor beforehand if you are planning for a pregnancy. So, ideally, you should visit your doctor beforehand, and that in that way, I will tell you what are the importance. So, if you will go from the age earlier, the people used to do their pregnancy in a little earlier age. Nowadays, they used to get married a little late. This is the normal pattern of a society, and then they used to plan for a pregnancy because of their lifestyle and because of their own involvement and the professional demand and everything. So if the pregnancy will be started on a late, there is so many things which to be ruled out beforehand. Not only that, even with even your the weight, your height, your the pre-pregnancy health status, these all matters a lot if you get used to pregnant. Suppose, for example, if the patient is planning for a pregnancy, ideally they should start that folic acid supplementation 3 months prior to conception, which used to be very helpful. And it's not only protect a patient from their protect a baby, it also protects so many diseases. So if the pregnancy will start and then you start taking the folic acid, it is beneficial, but ideally it should be started 3 months prior to conception, which used to be very beneficial for a baby, and it prevents a multiple congenital defect in a baby, which can be just popping one pill starting from a pregnancy or pre-pregnancy can prevent the multiple problems in your baby. So similarly, if you start your pregnancy, so today I'm going to divide in a different groups. Let us come first with the first thing is the your age. Age is definitely a factor for which is affecting a pregnancy. If you start your pregnancy with a late and you are planning for a pregnancy in later age or elderly age group, so you should visit ideally to the doctor. Why you should visit? Because in that situation we used to assess their body weight, the basal parameters like hemoglobin status, the blood pressure, and the sugar status. Nowadays, in general, in India, the chances of diabetes is very high, and sometimes the patient themselves is not aware about the diabetic status. So when they used to come in a pre-pregnancy checkup visit, so we used to do all the parameters related with all these diseases, and with that we used to assess. So suppose somebody is a diabetic and they will conceive, that lady will conceive within a diabetic status, the chances of complication is double than the normal individual, because the pregnancy itself, if the person's blood, the lady's blood sugar is not controlled beforehand and she conceived with that, the chances of the abortion, malformed baby, premature birth, and the complication during pregnancy is much higher than the normal individual. So by simple doing a testing and the diagnose with the diabetes, we can diagnose beforehand if she will come to the clinic, and accordingly she should be kept on a safer medicine. Sometimes the lady is already a patient of a diabetes, but she is not on a safer drug, and if she is planning for a pregnancy she should visit the doctor beforehand, and she should be switched on a safer medicine, so she should not land up with the drug adverse effect of a drug on fetus. So these are the things can be done beforehand. Similarly, like other medical diseases like hypertension, thyroid disease, if she is going through anemia, so this can be well managed beforehand, and if she will enter in pregnancy with the safer medicine and with the adequate level of these parameters, so the chances of complication can be decreased better. It will be decreased much. So, if I will come to the other points, like what are the other benefits, if you will, importance of the preconceptional checkup. The second is the nowadays, because of the aging process and the environmental factors, as you all know, so previously we gone through all that COVID era. So during that time, because of the COVID, so many factors in the body get changed, and the chances of the miscarriage is increased, say, after COVID time. So if the patient is coming beforehand, few medication we can start to improve a quality of egg. As with the age, the chances of egg, that good quality of egg is gradually decreased. Every female have a, there is a fixed number of egg, they born with the fixed number of egg, and the more you age, the quality of egg used to get deteriorated. So if you are doing your pregnancy in a late stage, to improve your quality of egg, we can start few medicine beforehand, and you will pregnant with the healthy eggs. So chances of the miscarriage and or the malformation in a baby or the complication during pregnancy will be decreased by simply starting few medicine. So similarly, if the patient is in a age elderly age group, they can go for the multiple things beforehand. Suppose somebody is planning their pregnancy at age of 35 years or 36 years, that the few parameters should be checked beforehand. As I said, the diabetes status, thyroid status, hypertension status, so these can be checked beforehand, and if she is going through any of the disease, ideally she should started on a medicine and that the disease process should be stabilized, then she should plan for a pregnancy. Simultaneously, we used to start the quality of to improve the quality, start a medicine to improve a quality of egg as well, and folic acid supplementation too. She should not land up with the pregnancy or adverse outcome of a pregnancy. Along with that, if the patient is planning their pregnancy, and if she is not, she wants to go for a further checkup, she wants to come beforehand, she will come beforehand, then she should be started with the multiple investigation apart from the routine investigation. So few things which is very very important are, another few things are which is important are the vaccination status. Sometimes the few patients are not aware about the vaccines which she has taken in childhood, but the few investigation can be done beforehand, and that will reflect either she is uh, immunized with that infection, or she required a that vaccination thing. If suppose the some rubella is a one of an infection which is very very hazardous for pregnancy point of view, if the somebody is positive with the active infection of the rubella and she will pregnant during that time, so chances of having the adverse effect on baby is very high, which comes in a multiple adverse effect can happen. It's even related with the heart defect and so many things can be happen. So that can be easily prevented if she will be checked, and if she is not immunized with the rubella vaccine, so she should opt for the vaccination beforehand, and after that, after taking that vaccination, after 3 to 4 months of that vaccination, she can plan for a pregnancy. So these things can be well taken care if you will come to the pre-pregnancy checkup beforehand. Along with that, sometimes, so nowadays we are facing with the either with the excessive weight or low BMI. The your what is your BMI high or low, both are not good for a pregnancy. If somebody is with a very very high BMI, the chances of the complication of pregnancy is double as compared to the normal individual. So if your BMI is high, usually in that patient we ask a patient to first to reduce their weight and then try for a pregnancy, so we can just prevent the complication related with the high BMI. Along with that, simultaneously, if the very very low BMI patient also land up with the multiple problems like intrauterine growth restrictions, premature birth, preterm deliveries, so these can be prevented if you will come during your pre-pregnancy checkup. You will be get your pre-pregnancy checkup. So these parameters to be taken care. Apart from that, simply by doing the hemoglobin CBC few tests, as I said. So one of the very very important, even when all social economic status, the low hemoglobin is very common in India. So that is called anemia. So if hemoglobin is less and the somebody is starting their pregnancy with a very less hemoglobin, the chances of complication is very high. So during routine checkup, they used to get diagnosed with a low hemoglobin, and ideally she should be treated beforehand before they are planning for a pregnancy. So if the only low hemoglobin can cause multiple problems starting from a very early pregnancy to the late pregnancy, the complication rate is very high. Along with that, if the somebody is diagnosed with the low hemoglobin, they should be ideally checked with the what is the reason behind the low hemoglobin. Just because of the deficiency of iron or something else? Because it's hemoglobin anemia is not only related with the iron deficiency anemia. Anemia can happen because of another reason also. So one of the reason which should be ruled out beforehand, that is the thalassemia. Thalassemia is a status which should be ruled out if somebody is going through anemia. So ideally she should go for the thalassemia workup, thalassemia checkup, and that can be done by the blood test. And if the blood test comes as a thalassemia positive, then we have to find what is the status of the thalassemia. Either she is a thalassemia major or thalassemia minor. If she is a thalassemia minor patient, then ideally the husband's the thalassemia status is also to be checked. And if husband is comes as a positive, that means that patient needs the further counseling and the detailed investigation before planning for a pregnancy. If the husband is negative, then nothing to worry. Then definitely she that patient required the little nutritional part correction, and she should be counseled about the what are the precautions to be taken beforehand or during pregnancy to just keep her hemoglobin level maintained. Because usually in a thalassemic patient, the hemoglobin level doesn't respond with the your iron supplementation or any kind of supplementation. They required a special supplementation. We only gives folic acid in that patient. Iron doesn't help much. So these kind of thing can be well taken care if you will visit your doctor beforehand, and that to be taken care. And apart along with that, if you are planning for a pregnancy, you should always know about your vitamin D level also, which is very very nowadays common, the deficiency of vitamin D. And the vitamin D deficiency also causes multiple problem in you and your baby. And even the fertility used to be get decreased if your vitamin D level is low. So just simple checkup and your investigation can prevent a multiple problems. So that's why the importance of pre-pregnancy checkup is very much. So I think you should aware about what are the importance of this. And if any question, I would like to answer your question. Thank you so much.